And don't take Tylenol. And don't give it to the baby after the baby is born.
A new warning from the White House says autism could be linked to the use of acetaminophen, an active ingredient in Tylenol during pregnancy.
The maker of Tylenol released a statement disputing President Trump's claim. It reads, quote, acetaminophen is the safest pain reliever option for pregnant women as needed throughout pregnancy.
Well, since the president's announcement on Monday, experts and advocates for the autism community across the world have been responding.
And joining us now to establish the facts about using Tylenol while pregnant, UW Health's Dr. Jeff Potoff. Hi, Dr. Potoff.
Hello. Hey, guys.
Good to see you.
Yeah, same.
So if you or someone you know is pregnant, this is a very confusing time. Putting politics aside, what does the research show about acetaminophen in pregnancy?
The research shows that acetaminophen, Tylenol in pregnancy is safe. There's been a lot of studies over the last several decades. If you look at some studies, you will see this call of like, is there this association? But the really well done studies will control for changes in the environment and genetic changes. And when you do that, so when you look at a mother who has one child, didn't take acetaminophen during the pregnancy, another child, so same mother, genetics are the same, probably same household, environment is the same, there is no difference in the rate of autism between those two siblings and whether the mother took Tylenol or not. Those are the best studies. Even the studies that show association, just tiny. So this idea that a mother today who is like feeling guilty because she took Tylenol during pregnancy and now has a child with autism, it just doesn't hold water when you really look at the research that's out there.
Yeah. I guess I have a two-part question. One, should doctors still recommend Tylenol use? And then, do you have a fear of a ripple effect? Even though there's no scientific evidence backing this claim, will this put a stain on Tylenol or put doubts into people's minds, and that could lead to some bad outcomes?
Yeah, no, I think as a physician, certainly we would recommend Tylenol. And one of the reasons is you could say, you know what, if there was zero harm in not using Tylenol, like maybe it would just be best not to use it. It turns out that that's not true. So women who are pregnant, especially early in pregnancy, who have high fevers, we know that that high fever can actually affect the fetus in a negative way. We also know women who have pain, they have elevated stress hormones. Those stress hormones are also not great during pregnancy. So there's actually harm in not using Tylenol, as prescribed for as long as necessary in pregnancy. So I think you do need to use Tylenol in pregnancy if you meet those indications.
Well, and as for the ripple effect that Brady was mentioning, you have actually had some patients come in and express some confusion now.
Yeah, I was talking to one of the leaders in the emergency department. I wasn't working there today, and we have families coming in with their children who have fevers and are asking that we don't give Tylenol because they're worried that it's going to cause autism in their children, which is just a little bit heartbreaking because those kids are suffering. We can alleviate that suffering. There is no risk to those children in giving them Tylenol, and yet people are confused, and that's sad.
How does the health community try to, I guess, fight misinformation out there?
Yeah, I think the best thing we can do is point people who are confused to good sources of information. And unfortunately, the internet is not that source. There is so much misinformation, particularly around this topic right now today, that if you are out there and you're wondering, like, what should I do? Should I take Tylenol? Should I not take Tylenol? Talk to your obstetrician if you're pregnant. Talk to your pediatrician if it's about your kids. Talk to your family practice doctor or general practitioner if it's about you. Those are probably the best sources to get your questions answered so that you can feel like you're making a good decision when everything seems to be a little bit confusing out there.
And just finally, to put a button on this, is there any scientific link between Tylenol and autism?
No, there is no good data that says Tylenol causes autism.
Thank you, Dr. Potoff.
Thanks, Dr. Potoff. Good to see you.
Yeah.